Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering narcissistic personality disorder. On the last video for psych I covered histrionic personality disorder. If you haven't watched that, be sure to watch that. That is part of the cluster B personality disorder types. Now we're going to do the other cluster B personality disorder type, which is narcissistic personality disorder. And what's so crazy, guys, we've been hearing a lot about narcissism on TikTok, on YouTube. We're hearing a lot about it on social media, but guess what? Not everyone is a narcissist. A lot of people are just jerks. There are certain specific manifestations that we have to see for a patient to be clinically diagnosed as a narcissist and to have narcissistic personality disorder. So we're going to clear that up in this video. Please, guys, support this channel by liking this video. You know you're going to love it. So go ahead, press that like button now, subscribe to this channel, and engage with me in the comments. Let me know what you thought about this video. Let me know if you'd like to see me cover something else. And don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com. All right, guys, let's get started. Narcissistic personality disorder. Look at what it says. It says, narcissistic personality disorder is characterized by feelings of entitlement, an exaggerated belief of one's own importance, and lack of empathy. So let's stop right there. Let's talk about this. So this person, that feeling of entitlement, that means that they feel like things are owed to them just for existing. Let's keep going. An exaggerated belief in one's own importance. They're the types that feel like at the job wouldn't even run without them. Okay, if they were not there, everything would collapse. Lack of empathy. Remember, I forget which video I did this in, but I talked to you guys about the differences of empathy and sympathy, and that empathy is being able to put yourself in someone's shoes and to be able to imagine what they would feel like, right? And that will help, make a decision on behavior. This person lacks that. Let's keep going. In reality, people with this disorder suffer from a weak self-esteem and hypersensitivity to criticism. Now, this is crazy because that person with narcissistic personality disorder, you would think that they had very high self-esteem. Why? Because they're always putting themselves up there like they're the best. But in reality, their self-esteem is really low. In reality, they really think very low of themselves. And that's why they have to project as if, they're the best. But internally, they have low self-esteem. Hypersensitivity to criticism. The person diagnosed with this disorder type, guys, any simple criticism, they take it as a personal attack. It's more common in males and females. Well, that's good because when we did histrionic, it was more common in females than males. But now that we're doing narcissistic, it's more common in males than females. The person with narcissistic personality disorder, look at what it says. It says that they come across as arrogant. And remember, guys, even though they're coming across as arrogant, they really have low self-esteem. They'll never admit it, but they do. They come across as arrogant and having an inflated view of their self-importance. The individual with this disorder has a need for constant admiration along with a lack of empathy for others. Let's stop right there. Why do you think that the author has mentioned this a second time? Because in 2 paragraphs up, we saw that they have a lack of empathy. 2 paragraphs up, we saw that they have low self-esteem. 2 paragraphs up, we saw that they like to make themselves more important than they really are. And now we come down 2 paragraphs and the author's saying the same thing, except they're wording it different. Why do you think that is? Because it's important, because that's an important concept to know for important nursing exams such as NCLEX, ATI, HESI. You better know this. Let me tell you something. Whenever you're studying and you see that the author tells you the same thing, but in a different way, so you read something and then a couple paragraphs later, you see the same thing, then you see that same thing in the diagram or in a chart or in the illustration, that means most likely it's going to be a test question. So make sure that you know it. All right. So let's keep going. Before we keep going, let me stop at this because I want to say something else. That need for constant admiration. They will turn any situation about themselves. They can be at a funeral And people are grieving, obviously, for the person that died, and they will find a way to make it about themselves, that they want to be praised. They want to be praised. They'll try to cry harder so people can say, wow, he's such a caring person. You know, look how hurt he is. Whatever it takes to have the attention on them, but good attention. They want to be viewed in a good light. So they have a need for constant admiration. The person with narcissistic personality disorder, they are the type, if they're in a relationship with someone and it's the person's birthday, they will completely ruin that person's birthday. Why? Because it's that person's birthday and it's supposed to be all about them, but that person with narcissistic personality disorder, they can't help it. It needs to be about them, and they'll turn things around and ruin that birthday just to make it about them so they can have that tension, okay? Let's keep going. It says, a factor that strains most relationships over time. Imagine being in a relationship with somebody who needed constant admiration, that couldn't handle even the slightest amount of criticism, that over exaggerates their self of importance. That's going to wear on you over amount of time. They're very sensitive to rejection and ding, 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 criticism, and can be disparaging to others. So while they're so hypersensitive and you can't say one bad thing about them, you can't even give them constructive criticism, they're quick to put somebody else down. Do you see what it says? Disparaging to others. A sense of personal entitlement paired with a lack of social empathy may result in the exploitation of other people, them taking advantage of other people because of those two factors. Whatever it is that they want, they feel that they're entitled to it, and they cannot put themselves in the other person's shoes emotionally, intellectually speaking, and behave on that. They don't have the ability to do that. So with those two factors, that's what causes them to be users of other people. Underneath the surface of arrogance, look at another way they reminded us that this person's arrogant. Underneath the surface of arrogance, people with narcissistic personality disorder feel intense shame, embarrassment, and fear of abandonment. They know they're a jerk. As much as they try to act like they're all that, they know that they are a freaking jerk. They know that they're lucky to be with the person that they're in a relationship with, or whatever that friendship is. They know that they're lucky, and they feel insecure about it because they know that person should have walked away a long time ago. In keeping with these descriptions, the main pathological personality trait of narcissism is antagonism. Everything has to be a fight. Represented by grandiosity and attention-seeking behaviors. What does grandiosity mean? It means thinking that you're way more special than everybody else. You have special gifts, or you have special talents, or you have special powers, okay? Grandiosity and attention-seeking behaviors, they have to be the center of attention. They have to be seen in a positive light and being admired by others. They tend to tolerate rejection poorly. Guys, I just went over like 3 paragraphs of telling us the same thing that the first paragraph told us. Guidelines. Nursing guidelines for this type of personality. Nurses should remain neutral and recognize the source of narcissistic behavior. What is the source of this behavior from the person? Their true feelings, which is what? Shame, embarrassment of self, low self-esteem. Okay. What do they mean by remain neutral? The patient with narcissistic personality disorder, they will try to antagonize you. They will try to enter into power struggle with you. You have to remain neutral. You cannot fall down their rabbit hole. Use a therapeutic nurse-patient relationship as an opportunity to practice how to engage in meaningful interaction. They have to learn how to act right. They have to actually practice. That's part of behavior therapy, and you're going to use therapeutic communication to help them practice that, okay? Avoid engaging in power struggles or becoming defensive in response to the patient's disparaging remarks. Because remember, those disparaging remarks all it does is reflect that inner turmoil that they feel of what? Being less than. And role model empathy, because remember, this is something that they lack. They don't have empathy, so you have to role model that. So just like with histrionic personality disorder, there's no cure, right? It's behavior therapy. Same thing with narcissistic personality. There is no cure. It's behavior therapy. So let's go to treatment. Individual cognitive behavioral therapy. Let's stop. Cognitive, how you think, and then behavioral, how you act. So it's therapy to change how the person thinks and views situations. So if they get constructive criticism, instead of taking that as a personal attack, to view it as, wow, this person really loves me. They care about me. They took the time out to tell me about this behavior so I can change, instead of taking it as a personal attack. So they're going to have cognitive behavioral therapy, and they can have a group therapy. Lithium has been added or used for patients with narcissism, look, who demonstrate mood swings. So the patient just has narcissistic personality disorder. We're not going to put them on lithium. However, many patients with personality disorders also have comorbidities. Excuse me. They can have bipolar disorders. They have mood swings. Yes, a lithium may be an option, right? Antidepressants, they can get antidepressants, obviously, guys, if there's depression involved in this diagnosis. And guys, that is it, because next is avoidant personality disorder, and that's for another video. Guys, that is your narcissistic personality disorder in a nutshell. And I hope this video was helpful, because for everything that's going on social media, that's all you're hearing about, narcissistic personality disorder, but some people are just jerks, okay? Now you know what that patient clinically, that is clinically diagnosed as narcissistic personality disorder, what they look like, what those nursing interventions would be. I'm going to be sure to continue with these videos. It may not be concurrent, but I promise it's coming up. Don't forget, guys, let me know in the comment section what you thought about this video, what you would like to see me cover. Guys, you can catch me almost every day covering different types of questions on my other social media platforms, such as TikTok, Instagram, and Facebook. And please don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com. Oh, one more thing before we go. I see that a lot in the comments. You guys want to know what book I'm teaching from. I've been teaching from this book for a couple weeks now. So this is it, okay? 8th edition. This is a great book. That's what I'm teaching from. So go ahead, engage with me in the comments. Let me know what you thought about this video. Thank you so much for watching this video, and you guys will catch me on the next video.